to my channel. So first of all, apologies for going completely off the radar for the last few months. I finished my chemo in January. It's now August, and in fact today is my Cancerversary. So exactly a year ago today, August 23rd, I was diagnosed with my triple negative breast cancer. And what a year it's been. So for those of you that haven't followed my journey or need reminding of what happened, I was diagnosed at the age of 34 with stage 3B breast cancer. Turned out to be triple negative. Turned out to be BRCA1 gene mutation. So I had 6 rounds of chemotherapy, FEC-T, so I had 3 rounds of FEC and 3 rounds of T. Then followed it up with a double mastectomy, so one was therapeutic and one was prophylactic, risk reducing. So that was in March, and since then I've kind of just been getting back to the real world. So I thought I'd give you an update on what's sort of happening, how I found it, what's going on in my life, what's going on with treatment. So I went back to work in April, which was about 7 weeks after my double mastectomy and reconstruction, which was tougher than I expected. So when I was going through my treatment, I can remember reading a lot of research that said that cancer patients found going back to real life and following treatment the hardest part of the treatment. And I can remember reading it when I was going through treatment and thinking, that won't happen to me. I'm going to be so happy to be finishing treatment and getting back into my old life. Well, it did happen to me. So it was a tough transition. I think one of the hardest things to deal with when you finish treatment is the lack of checkups. So when you're going through treatment, you get constant checkups. I was having weekly blood tests. I was having monthly appointments with my oncologist. I was seeing the breast care nurses a lot. I was seeing my surgeon a lot. So every week I had at least 1, if not 2 or 3 appointments. So you feel very supported by that. So following my surgery, not that I was discharged, but there was much less need to have these medical appointments. So that was kind of a hard transition that I didn't really anticipate. And I think I kind of lulled myself into a bit of a false sense of security. So I kind of thought, oh well, once treatment's finished, I'll go back to work and I'll just be back to the old me. So that doesn't ever really happen, I don't think. So before cancer, you're this one person, you're this one identity, and you might do different things. So for me, I was a fitness fanatic. I go to the gym all the time. I was health conscious. I was a master's degree student. I was a bit of a career head, definitely a goal orientated person. Prided myself on being very professional. I was a single mom. Prided myself on bringing my boy up and being very active with him. So when I got diagnosed with cancer, all of that kind of had to stop. So I wasn't allowed to go to the gym. My oncologist said, no way, simply because of the risk of infection. So I put on quite a bit of weight quite quickly with the steroids. So that in itself kind of being maybe a little bit too proud of my appearance. I gained a lot of weight quite quickly. I was allowed to walk, so I carried on walking, which actually was my saviour through chemo, and I've still got a love of walking now. I had to stop my master's degree, so I've had to put that on pause, which isn't a bad thing actually, because I don't think I could do that right now. I took 6 months off work. So all these things that you identify as being and having them as part of who you are, it all stopped. So during treatment, that was just, you know, you focus on the next treatment, the next step of your treatment. So it could be the next chemo, get that over and done with, the next blood test, the next scan, the next appointment, the next surgery. So then when you get to the end of it, you kind of expect to go back to that old you. So you've had that one identity, then all of a sudden you're identifying as a cancer patient, which is fine, you know, it's just one of those things. You're bald, you're bloated, you look ill. But then you kind of expect that at the end of your cancer treatment you'll just go back to the old you, and that doesn't happen. So I got to the end of my treatment and I just thought, oh well, you know, I'll go back to work and it'll be fine. I'll go back to uni, I'll go back to the gym, and I'll go back to my old self. It sounds really strange, but I hadn't really prepared myself for having short hair. So my hair is obviously, it is growing now, finally. It's growing back with kind of like a bit of a weird wave to it that it never had, and it's so much darker than it was before, and it's so much thicker. But I can't really, I've never had short hair before. I've always had really long hair. I've always dyed it. I dyed it bright red, I dyed it blonde, but it's always been long. And that, in a way, that threw me. I know that I was bald for 6 months, but I always wore really long wigs whenever I went out. So I never kind of grieved for my long hair. So now I've got this short hair, which I do like. It's a lot easier, but it's not me. So that hasn't helped. Because I look in the mirror and I'm just, I don't know, it just doesn't look like me. So that took a bit of adjusting too. Things that I'm still dealing with since chemo, that kind of chemo related. Chemo brain's the biggest one. It's frustrating more than anything, and I think it's frustrating because it feels like sometimes people think that I'm making an excuse, whereas actually it's still very much real. I think my body's still trying to get rid of some of the toxins in my body from chemo, so I find when I go to the gym now I sweat so much more than I ever have. Like literally, it's disgusting, I know, but it just drips off me, and I think that is your body's way of getting rid of toxins. Obviously I've still got a lot of toxins running through my body. I get tired very quickly. Nails. So with my doxycycline, which was the second drug that I took for my chemo, it's very well known that you can have, it can make your fingernails and your toenails drop off. Blech. My toenails, I had my big toenails went a bit black and kind of started to drop off, but it was just the end. I know, it's really gross, I'm sorry. And I thought I'd escaped with my fingernails until probably May time, so we're talking like 4 months after my chemo finished, and I got my nails done every week through chemo because they say if you use gel on your nails, it stops the ultraviolet light from hitting your nail bed, which is what causes them to drop off. So I had my nail girl do them every week. She's very good, I love her. And then in May she started to say, look Nick, your nails are starting to detach on your nail bed. And it's really weird because I could feel them detaching. It was like I'd get a sore nail for a couple of days, and then it would just, it's a really weird feeling, like it's like kind of, I can't even describe it. I just knew that they were like detaching. So I had like quite long nails at that point, so she had to take them right down, and luckily none of them dropped off. None of them went black, none of them dropped off, and they have actually grown out. So now it's August, it's 3 months later, and they've almost all grown out, but they're better now, so that's the main thing. Other things that I'm dealing with, the biggest thing I think is the health anxiety aspect of it, which I think all cancer patients go through it. You know, I was given the all clear. I was told I was no evidence of disease in March after my surgery because I had a complete pathological response, which means that the chemo completely killed the tumour itself. So they can't say that I'm cancer free because they don't know whether any stray cells got into the blood system. So it's just playing a waiting game with that. And that's the biggest thing, you're watching every little ache and pain. So I had some vertigo in June, quite bad vertigo with headaches. So of course you start thinking, oh well, it's spread to my brain. And you do get yourself in a right tiz. So I phoned my oncologist and he just said, look, it's too early for it to spread to your brain. So, and as it turned out, it was just the stress of being back at work that set off my vertigo, and I should have known that because I do get vertigo when I'm really stressed. But now I've got rib pain the last few days, so of course then you start thinking, oh well, it spread to my bones. So it's a constant yo-yo, and you logically think, no, look, you need to just chill. You're still going to have aches and pains because your body's still recovering. It's really hard not to fall down that rabbit hole of getting anxious about every little ache and pain. So that's something that I'm still dealing with. The boobs, since my double mastectomy, they're getting better. I'm more used to them. I can lie on my side now. That's very exciting. I say lie on my side. I need to kind of hug a pillow whilst I'm doing it to keep my boobs from moving from one side to the other. I am supposed to be having some fat grafting surgery, so it's called lipomodelling, where they're going to take some fat from my thighs, which I think they'll be hard pushed to because since being back at the gym, I've dropped a little bit of weight, so my surgeon's going to tell me off. And that was supposed to happen at the beginning of August, and then it got cancelled, so, and it hasn't been rescheduled yet. But they are going to take some fat and they're just going to fill out some. I've got kind of some rippling, like quite bad rippling actually on my cancer side. Obviously where they took more tissue than they did on the left. And also you can kind of see where the implant meets the skin because I'm very slight on top. So they're just going to fill that out. So I've got to wait for that to happen. So that's kind of another thing that's hanging over my head, and I just kind of think, right, I've got to get that over and done with. I think the biggest thing is kind of that change of priorities more than anything. So my priorities now, I used to be very goal orientated, and I don't know whether it's a temporary thing or a permanent thing. I just haven't really got it in me at the moment. I want to be at home, I want to be spending time with my family, with my little boy, who's not so little anymore, with my friends, and I still love work and I love my job and I love my colleagues, but I just haven't at the moment got that drive to succeed, which is kind of understandable. I think it does change your priorities. You can't take money with you when you're gone and all that crap. So we'll just see how that goes. So it's been a tough few months. So since April, so what's it, August now, so the last 4 months have probably been the toughest really. I've had a lot of stuff going on, having to deal with things like self-esteem. My body looks different to what it did. It looks good. I am quite pleased with the results. There's still some room for improvement, so I'm going to have another surgery or two. But in clothes, my boobs look great now. They look really good. I don't ever have to wear a bra. They're sort of up here. They're really perky. But they're different and they're not my old boobs, so I've got that to kind of get used to. I don't look the same, like my hair's growing back now, but I don't look like the old me. And I had a lot of anxiety, almost likened to post-traumatic stress. I haven't been diagnosed with post-traumatic stress, but there are certain elements of my anxiety that are very much like that. So I've been having panic attacks, I've been having headaches, stomachache, nightmares, flashbacks, general fear of it coming back, which I'm told is all very, very natural. Doesn't feel very natural, but it's to be expected from someone that's been through so much. I think the problem with cancer treatment is you're diagnosed and then straight away you are on your treatment path, you don't have any time to process it, you're just survival, 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 and then all of a sudden you get to the end of it and you literally sit there and go, what the fuck just happened to me? So I kind of had a bit of a few weeks where I just went a bit, I wouldn't say doolally, but I couldn't sleep, I couldn't eat. It didn't help that I kind of went through a breakup as well, so I broke up with my boyfriend who was there for me through the whole cancer treatment, and that was really hard, so that set off a whole load of other anxiety, which I think triggered a lot of processing in terms of dealing with what I'd been through. He was definitely my security blanket, and all of a sudden he wasn't there, so that was really, really hard. So I got referred for counselling, and I'm still waiting for that, but that's due to start soon. So I did get some counselling through Macmillan, which was quite nice. They're sending me for some cognitive behavioural therapy to deal with the anxiety. So that's all good, that's all moving in the right direction, and I think it's all very normal process. And I don't think there isn't really enough support for the mental health side of cancer treatment, which is a bit of a shame actually, because it affects so many people, and I'm quite a strong, resilient person, but it's even surprised me how much it's affected me. At a point where I thought I would be happy, you know, to be over and into this kind of having kicked cancer's ass and been, you know, moving forward with my life, it kind of threw me for a loop really, that I just wasn't mentally catching up and being back to where I wanted to be. So that was really hard. I feel like I'm coming out the other side of it now. So today is my Cancerversary. So it was 1 year ago today that I was diagnosed, and I was surprised at how emotional I was this morning actually, because it brings all the memories back. It brings the memories back from my diagnosis, about being in that room, about having to phone people and tell them the news and console other people about, I'm going to be okay, don't worry, I'll be okay. It's all a bit of a surreal experience actually when you think back on it. So moving forward with my treatment, because I was triple negative, I don't have any more treatment, which it has pros and cons. I'm quite happy that I don't have to take more medication. I hate taking medication, it's vile, I hate the way it makes you feel. I'm quite health conscious, so putting drugs into my body just doesn't agree with my body at all. I met my oncologist last week. He's quite happy. I don't have to have any scans necessarily. He's left that up to my surgeon, my breast surgeon, about whether I need any MRIs and ongoing scans. But as far as he's concerned, there's no breast tissue, so there's no need to scan me. I have to watch out for symptoms of stage 4 secondary breast cancer spread. So I have to watch for symptoms that might indicate it's spread to my brain, my bones, my liver, my lungs. And if I have any of those symptoms, I need to phone my oncologist straight away and he will see me. So he hasn't discharged me. I will be seeing him again in January, and then every 4 months for the next 2 years, which is good. I know a lot of girls that have been discharged straight after chemo, so I'm quite lucky that my oncologist wants to keep an eye on me. In terms of surgery, I've got my lipomodelling, which should have been done a couple of weeks ago and got cancelled. And they can't seem to give me another date at the moment. They're just fanning around, so we'll see. Hopefully that'll be done next month in September. So that'll be done next month. If that doesn't work, because there is a chance of my body reabsorbing the fat, which I think will probably happen, because I'm very, my body shape is pear shape, and whenever I lose weight it always comes off the top half of my body, always. So So if that doesn't work, I will probably need to have my implants swapped out for different ones. I don't like the implants that they put in. So they put polyurethane implants in for me because they didn't know if I was going to have radiotherapy. They put these in and they're a lot, the texture's a lot tougher and a lot harder than the silicone ones. So I might push for them to be replaced anyway. So we'll have to see about that, but that won't be until next year. So that, in terms of my surgery side of it, that's all cosmetic anyway. So it's not anything to do with the cancer as such. And that's not going to happen for a while. Other treatments, that's about it. I just need to be mindful about my ovaries because of being BRCA1. So I have to watch for any sort of abdomen pain, changes, that sort of thing. I am scanned every February for that. So I have a ultrasound scan of my ovaries, and I also have a blood test for my CA125 levels, which is a kind of a cancer indicator, cancer marker. So ongoing, that's about all that I can do. And that's about it really. I'm just back to being a bit boring really. I'm going out far too much, drinking probably far too much, attending far too many parties, going to the gym all the time. I'm trying to spend as much time as I can with Harry. We've started horse riding, so I'm teaching him to horse ride, which is fantastic. So that was something that I hadn't done for years, and the cancer made me think about what things made me happy, so that was definitely one of those things. So we are horse riding. In fact, we're going to go in a second. We're going to go down to the stables and see the horses. I am training to walk up a mountain, so I'm walking up a mountain. I'm going to get a tattoo. I want to get my nose pierced. Shh, don't tell my mum and dad. I want to do a skydive. So I've written a bucket list of stuff that I want to do. So I'm slowly getting through my bucket list, which is great. And that's about it. I'm going to use the tacky phrase, I'm trying to live my best life. But it's true. I think cancer, much as there are plenty of negatives about cancer, there are also plenty of positives, and it certainly puts things into perspective and makes you realise that you shouldn't really take things for granted. So on that note, I'm going to go and take my boy horse riding. And I'm sorry that I've not done a video in so long. I'm going to try and do another one soon. So I hope you liked this video. If you did like it, subscribe, hit like, and I will see you soon. Bye!